A very warm good evening to all the August audience and our guests who are here with us today. It's a beautiful Sunday and also marks the Oral Cancer Awareness Month, where ICanCare, along with the Sterling Cancer Hospital Foundation for Head and Neck Oncology, is organizing the Oral Cancer E-Conclave for the entire month. We are going to have 4 Sundays, which are full of wonderful scientific sessions for the audience and for with great academic content as well as great practical learning from prolific oncosurgeons who are here with us today on this event and will address us, and from whom we will have a wonderful opportunity to learn a lot of things. I thank all the partnering organizations and their respective representatives who are here with us today, who have been tirelessly working for the past fortnight to make this event really grand and successful. I'm sure that today there will be a lot of new things, a lot of new teachings, a lot of new experiences coming together on this forum, on this program. I'm very pleased now to invite Dr. Pooja Nandwani Patel to invite all our esteemed guests and dignitaries for the evening on the e-dais.
Thank you, Shruti. It's my privilege to have these all esteemed dignitaries joining on this web platform. And it is always a delight to invite Anil Dikro, sir. And he is the president of Union International for Cancer Control, and he is the director of Apollo Cancer Hospital. Welcome, sir. Again, a very privilege to invite Professor Dr. Himanshu Pandya. He is the Vice Chancellor at the Gujarat University, Ahmedabad. The convener and the person who is behind this conference mainly, Dr. Pawan Gupta. He is the director, Head and Neck Max Institute of Cancer Care, and the chief medical advisor, ICanCare, and also the national convener, Certified Tobacco Cessation Specialist courses. My pleasure to invite Dr. Harit Chaturvedi, who is the chairman at the Max Institute of Cancer Care, New Delhi. Dr. Alok Thakkar, a warm welcome, who is the president of Foundation of Head and Neck Oncology and also the head of the department at ENT AIMS. A privilege to invite my boss, Dr. Somesh Chandra, director at the Sterling Cancer Hospital, Ahmedabad. Dr. Reena Kumar, who is the academic director, ICanCare National Director, Certified Tobacco Cessation Courses. A privilege to invite Dr. Vikram Kekatpure, who is the honorary secretary of FHNO and also the director at ICanCare Cancer Hospitals. A warm welcome to Dr. Meenu Walia, who is the senior director, Clinical Care Center, Max Institute of Cancer Care. And of course, somebody from my hometown, Professor Dr. Rakesh Rawal, who is there at the Department of Life Sciences, Director of CUSEC, Coordinator of the Gujarat University Certified Tobacco Cessation Courses. So, a warm welcome to all these esteemed dignitaries on this web platform. And I take this privilege, and I am very sure that this program is going to be a wonderful program and learning program for all of us. Over to you, Shruti, again.
Thank you so much, ma'am. And let me introduce Pooja, ma'am, to all our audiences here. She's senior consultant and head from the radiation department at Sterling Cancer Hospitals and a very prolific oncosurgeon herself. With this now, we move ahead towards our inauguration session, and I'll request our chief patron for the evening, Dr. Anil sir, to please press the inaugurate button, and then we will have the digital inauguration of our function.
Thank you, Shruti, for the honor. And here I am hitting on the button.
A big round of applause, everyone, on your cameras. Thank you so much, sir. I think that was really wonderful. And now we begin the session, actually. So we will have a short lighting of lamp. That was the e-lighting, the digital lamp lighting from all the dignitaries on the e-dais. And now with this, I invite Dr. Harit K. Chaturvedi, who is chairman at Max Institute of Cancer Care India and currently the president-elect of Indian Association of Surgical Oncology, to kindly give his inaugural address. Sir is a very prolific oncosurgeon once again, and he has more than 30 years of experience in the current field. He also leads oncology team at Max Healthcare, which has 80 centers across Delhi NCR region. His focus is on providing quality care through various initiatives like virtual tumor boards and driving subspecialty built up across the Max centers. He drives the ambitious oncology vision at Max Healthcare with a strong focus on people, processes, and systems, and has key role in clinical quality processes, clinician recruitment, and long-term vision and strategy for the group. It is a privilege that we have Sir's presence, and I'll invite him to have his address now.
Thanks, Shruti. Actually, Dr. Harit, I will just say a few words on behalf of Dr. Harit, because Dr. Harit is right now in the hospital for some emergency. So Dr. Harit has sent his best wishes for the program, and he has wished this 4 weeks program to be a enlightening one for the participants. And we have approximately 1146 people who have joined, who have registered for the program, and across 4 weeks. So it is this oral cancer, which is basically the most important cancer in India, which is which needs to be taken care. So this program was made along with Dr. Harit, who is my boss at Max Hospital. So he sends his best wishes for the program. Thank you so much. Shruti, please continue.
Yeah, thank you so much, sir. And now I'll invite Pooja ma'am once again.
So, as we say, the boss is always right. But I think I'm very blessed to have such a boss that who always takes along with his companion. And it is my privilege to invite and welcome Dr. Somesh Chandra sir, who is the director at the Sterling Cancer Hospital. He has served at the prestigious Gujarat Cancer Research Institute as a professor over 7 years as faculty, and has been also the director of oncology at Kailash Cancer and Research Institute, Goraj, Vadodara. He has innumerous publications to his credit and has served many organizations at very prestigious posts. Has a decade of experience with central lymph node technique and mammoplastic techniques in breast cancer. Has a vast experience in various oncology cases, also in the robotic surgery, scarless head and neck surgery. I think his experience and, of course, his contribution to the oncology field will make a remark today when we have here with us. Also, he's waiting for his very important talk on the second Sunday. So, my privilege to welcome you, sir. Dr. Somesh, sir, over to you.
Thank you, Pooja, for that unbelievable introduction. And a very warm welcome to all the dignitaries, Dr. Intrigues, Dr. Alok, Dr. Pawan, yourself, Dr. Raval, and all the people who have joined us on this program. Actually, these introductory statements were to be made by Dr. Pawan Gupta. So I speak on his behalf. He called this entire program Intrigues of Oral Cancer. The first thing which was intriguing to me was that he chose not to label it as head and neck cancer. So that's the first message which he has tried to give to all of us, that oral cancers are quite heterogeneous, and they certainly cannot be clubbed and taken as the same as all other head and neck cancers. And over the period of coming 4 weeks, we will unravel what are the intriguing issues, and we have best experts right from the president of the UICC and the president of FHNO to guide us through these 4 weeks of interesting sessions. Thank you.
Thank you so much, sir, for the address. And now we'll invite Vikram, sir, on the dais. Sir Vikram Kekatpuri, sir.
Good afternoon. So it's my privilege to introduce our president, Professor Alok Thakkar, who is the current president of Foundation for Head and Neck Oncology. Professor Alok is also head of ENT and Head and Neck Services at All India Institute of Medical Sciences. He has been a founder member and a very passionate member of Foundation and leading the field for improving the oral oncology and the head and neck oncology care in the country. Besides head and neck oncology, he has special interest in skull-based conservative laryngeal surgery, transoral surgery, robotics. So over to you, Alok sir, for your address.
Thank you, Vikram. So let me first say that it's great to see the enthusiasm and the energy of this group. So it's really nice. And of course, my greetings to Dr. D. Cruz, Dr. Sumesh Chandra, Dr. Pawan, Dr. Pooja, and frankly, everybody else who's been part of this enthusiastic organization. So we at the FHNO are obviously happy, more than happy, and obviously privileged to be part and parcel of this collaboration that we have just gone through. It's been I would say, a whirlwind round of organizing in the way that we have gone around organizing this 4 weeks of academics. And we have managed to put through an excellent program with an excellent faculty, which to my mind is not quite inspired and inspired by the priorities and the questions of the West, but by the priorities and questions that we face in our world. I really look forward to it. I am sure it's going to be an interesting 4 weeks. And of course, we look forward to further collaboration. So thank you all.
Thank you so much, sir, for the address. And now I am extremely happy to invite our dearest academic director from the ICanCare Academy, Dr. Reena R. Kumar. She is an extraordinary person and very passionate about the cause. She's also working at the National.
Thank you, Shruti. Thank you so much. I think we'll just skip all that and we'll just go on.
Sure, ma'am, sure.
Thank you, Shruti, for this invite. And on behalf of ICanCare, Team ICanCare, the President UICC, President FHNO, Director Sterling Hospital, and all our partners, we are so delighted to have all of you here today and make this into a program which is unique. In this month of April, a lot happens, yes, because oral squamous cell carcinoma is one of the most prevalent cancers worldwide. And it is considered a very aggressive tumor, and majority of our patients display so many loco-regionally advanced disease. And as oral cancer has multiple etiologies and is primarily linked to health-related behaviors and incidence of oral cancer, can primarily be effectively controlled, I would say, with health education and preventive health care in the public. So when I am speaking here on the dais of ICanCare and representing ICanCare, I would say at the heart of ICanCare protocol lies education, advocacy, and empowerment of all sectors of society. The spectrum includes healthcare professionals, institutions, youth, teachers, social responsible bodies, corporates, and public at large. Because through our numerous courses to address the skill and knowledge gap through digital empowerment solutions and public awareness campaigns, that is how we at ICanCare are focused on making sure that this particular menace in this month is what is reached out and always from our platform. Thank you so much for being here today with us, and we look forward to an evening of collaborative learning towards best practices and preventive and therapeutic clinical outcomes for our patients. Thank you, Shruti.
Thank you so much, ma'am, for the great words. It's an honor to now invite Professor Dr. Himanshu Pandya, who is Vice Chancellor from Gujarat University. He is also into an emergency visit and he's not here with us today, but we have on his behalf Dr. Rakesh Rawal, who is the professor from the Life Sciences Department and also the course coordinator for the tobacco cessation courses between ICanCare and Gujarat University. So now I invite sir to have Himanshu sir's message on his behalf. Rakesh sir, over to you.
Yeah, thank you, Shruti. Good afternoon, everyone. It's my privilege and pleasure to read out the message of our Honorable Vice Chancellor, Professor Dr. Himanshu Pandya. He says, greetings from Gujarat University to all dignitaries and cancer experts present here. I wish to extend my sincere gratitude to the organizing team of the E-Conclave for inviting me. I really wish to interact with you all online, but due to some unavoidable reasons, I couldn't make it possible this time. I came to know that April is designated as the Oral Cancer Awareness Month with a purpose to make all-out effort to reach out to the public, physicians, surgeons, and dental practitioners so that they incorporate the knowledge in their practice, which will make a huge difference in the incidence as well as outcome of this dreaded disease. There is a huge gap, and more of the primary health care specialists need to be trained. Gujarat University looks forward to introduce more such courses and collaborative research on early diagnostic markers, risk stratifiers, and prognostic indicators, which will have impact in the lives of the common people and influence the economic growth through Healthy India. I congratulate ICanCare, Foundation of Head and Neck Oncology, Sterling Cancer Hospital, Max Healthcare for organizing the E-Conclave on oral cancer with the theme Intrigues of Oral Cancers. And I'm sure it would have a huge impact in the days to come. I wish all the best for the success of the conclave. Namaste.
Thank you so much. So that was a wonderful message from our dear Vice Chancellor. And now this is the moment for which we have been waiting, the address of our Chief Patron. And now I'll invite Reena ma'am to first introduce Anil sir to all of our audience.
Thank you, Shruti. It is such an honor, Dr. Anil sir. This is like, for me, it's the evening is made because Dr. De Cruz, the president of UICC for the term 2022 and director oncology, Apollo Hospitals, ex-director at Tata Memorial Hospital, Mumbai, a researcher, administrator, and crusader beyond par in the field of cancer control with special interest in tobacco advocacy, cost-effective treatment, and health economics. Dr. De Cruz has served at the UICC Board of Directors for 2 terms, adding value in membership, governance, and finance committees. He was also Program Committee Co-Chair for 2016 World Cancer Congress at Paris and member of the World Cancer Congress Organizing Committee for the Melbourne Conference in 2014. Dr. De Cruz served as editor of Manual of Clinical Oncology, a UICC publication, and of course he has a pivotal contributions, over 200 peer-reviewed publications and over 300 lectures, 50 named orations, plenary lectures, and keynote presentations around the globe. Dr. De Cruz, sir, thank you so much for being with us, and we are so honored. We are waiting to hear your pearls of advice and your address, sir.
Thank you very much. Humbling words. And thank you to the organizers for having me on such an important program. For us today, in our Christian calendar, it's a big day. It's Easter. It's one of our biggest festivals. But when Pawan and Shruti invited me, I said I must come for this program because to me, it's something that needs to be done. It's something dear to my heart. But most importantly, it's the need of what we need within our country today. Oral cancers, and this has been said by various speakers, is probably one of the highest incidence cancers in our country. I've been treating it for more than 30 years. It's a paradox because this cancer can be detected very, very early. Unfortunately, the majority of people in our country come at advanced stage. People get treated at various places and not correctly. And I think Pawan and the organizers have really put a wonderful 4-week program together where they cover each aspect of oral cancer. It goes from early detection to early cancers to locally advanced and to rehabilitations. And this is a cancer, as has been said by previous speakers, that has a poor outcome, has severe functional and cosmetic morbidity affecting the quality of life of our patients. As I treat patients with oral cancer, I believe that 50% of the work that I do is redo cancers that have not been treated correctly at the first bite by other clinicians who are not initiated in the field. And again, congratulations to the organizers putting together a great program, but more importantly, getting together the who's who in the field from within the country. People who treat this cancer with finesse day in and day out, and they'll be able to share their experiences and probably get many a youngster who tunes in for these programs to treat patients correctly. But I think most importantly, while we treat our patients, we must remember that oral cancer is a preventable cancer. And great kudos again to ICanCare group, the entire leadership for putting together this crusade against tobacco. As you look at statistics from within our country, over 40% of our countrymen, sometime or the other in their life, would be addicted to tobacco. That's a huge number. And while you lead literature in the West, where there's a lot of focus on smoked tobacco, about 2/3 of all tobacco consumption in our country is chewed. And I think institutions, organizations such as ICanCare can take this message of tobacco out, and hopefully in the years to come, we'll have less consumption of tobacco, prevention of a large number of cases, helping with early detection and right treatment for our patients. So while today I'm chief patron, and I get worried when they call me chief patron, it looks like my time is up treating patients. When they put you into the patron bracket, means that, sir, your time is up. But jokes apart, while I'm here today as president of the UICC, I think my heart is in this entire 4 weeks of program, more as a clinician who treats these cancers and really feels the need that these cancers need to be prevented, early detected, and treated appropriately. So thanks once again for having me today to inaugurate this lovely session, and I'll be following all 4 weeks of the proceedings. Good luck to the organizations, speakers. We'll expect the best from you, and to all delegates to listen to us. Take home as much as you can, because you're talking to the who's who in the field from within the country. Thank you once again for having me here this afternoon.
Thank you so much, sir. Ladies and gentlemen, please a big round of applause for Anil De Cruz, sir. That was a wonderful thought which has been given. And I'm very happy, and we are extremely honored to have your gracious presence, sir, and we'll have you throughout the 4 sessions. With this, now I invite Dr. Vikram Kekatpure, who is Secretary from Foundation of Head and Neck Oncology, to give the vote of thanks. Sir has been the secretary and has been tirelessly working to make this event successful, and also to ensure that cancers are prevented and it's being handled very well. He's a senior consultant and director of Head and Neck Oncology and director of Tissue Repository Program at savetheyouth Cancer Hospital, Bangalore. With this, I invite sir on the forum on the e-dais to share his words.
Thank you. Good afternoon, everybody. I would really like to thank, on behalf of the organizing committee, each one of you for joining this campaign to create awareness regarding oral cancer from prevention to management of advanced disease, jointly organized by Max Healthcare, Sterling Cancer Hospital, ICanCare, and Foundation for Head and Neck Oncology. Real thanks to Dr. De Cruz joining us today on a very important day, but that just goes on to show his commitment to the field of oral cancer, patron-in-chief for inaugurating the meeting, and a very meaningful address with the deep insights with years of experience. It is an honor to have you, sir, as a faculty for this meeting. Dr. De Cruz is a foremost leader in the field of head and neck oncology and a mentor to many in this field. We acknowledge the support from Dr. Pandya, Vice Chancellor, and for a very pertinent message. Oncologic leadership of Dr. Harit Chaturvedi from Max Hospital, Dr. Somesh Chandra from Sterling Cancer Hospital, Alok Thakkar, President of Foundation for Head and Neck Oncology, deserve credit for unwavering support and guidance for the program. Dr. Pawan Gupta has really been instrumental in organizing this meeting and aptly supported by Dr. Pooja, Professor Walia, Professor Raval, Dr. Reena Kumar, and all the partnering organizers. Really appreciate the hard work which has gone in putting together this program. Also acknowledge our MC today, Ms. Shruti, and the entire technical team. Very grateful finally to all our faculty and most importantly, the participants. We request all of you to take this opportunity to interact and learn from faculty and also from each other's experience for ultimately prevention and improving the care for our oral cancer patient. Hope you have a great academic experience. Thank you very much.